What kind of blood type is the kind that we need most in the world? What kind of blood type is yours? Do you know your blood type? Well, there are different kinds. Most of us are A positive, maybe B positive, maybe AB positive. But there is a kind of blood that the world needs most. And the technical name is O negative blood. It's called the universal donor. If you provide O negative blood, almost anyone can receive that blood without a reaction. And so as those who are seeking blood, O negative is just wonderful. The world needs much more of them. Shanghai. Like many United States cities, Shanghai is an area of great wealth. It's a city that's prosperous and has marvelous skyscrapers. But just like urban settings in the United States, Shanghai has also great poverty. At the base of those beautiful monuments are millions of people who are surviving day to day with many of the same health problems that we've been talking about over the last 2 days of this conference. So as a resident physician at the Shanghai Charity Hospital in the 90s, I saw by far most commonly people suffering from tuberculosis, from rheumatic fever complications, from schistosomiasis, that exotic disease of poverty. Well, China provided a wonderful opportunity for a young physician to learn how medicine can be practiced in another culture. But for me, it wasn't only a medical experience. It was a chance to study Chinese, to learn about their culture. And as I traveled throughout the city, I would see pagodas everywhere. So pagodas are a religious symbol. It's a cultural symbol. It's a national symbol. And so they construct these things almost like everything in the developing world using a scaffolding. Now, scaffolding has many advantages. For the work on a pagoda or a great cultural piece of architecture, it allows the workman to be able to do the careful carvings, the painting on the outside that make these structures just so wonderful to look at. So one evening, I'm at Shanghai Charity Hospital, and I am the surgeon on call for trauma. About the same time, a young Chinese man by the name of Guo Li is working on a pagoda. He's a construction worker. He's about 20 years old. He spent the entire day on this bamboo scaffolding, doing the fine artistry that makes for such a beautiful result. And as he was stepping down, he put his foot on a bamboo and it snapped. And his co-workers looked at him just in time to see him plunge headfirst over the side of the scaffolding. 15 stories below was the street. So they ran to the spot expecting to find their co-worker splattered on the pavement below. And instead what they found was Guo Li jackknifed over the top of a bamboo rod about 30 feet below them. Well, he was still conscious. He was crying out in pain, and they scrambled down the scaffolding to Guo Li and managed to extract him off of that and put him through a window and carry him down through the stairs, the inner core of the pagoda. On the street, they flagged down one of those flatbed bicycles, and they laid him on the back of that little three-wheel thing, and they pedaled him into the inner of the city at Shanghai DR Yixue where we received him in the emergency department. And so when I saw Guo Li, he was writhing in pain. His blood pressure was only 90. His pulse was 150. His abdomen hurt everywhere. And actually, the one thing he said to me was, "Why is my abdomen getting larger?" Why do you suppose? He was bleeding internally. He had a ruptured spleen, I suppose. And so he needed surgery urgently, but the first thing in preparation for surgery was we needed to give him blood. We needed to give him intravenous fluids because he was going to die in the emergency department before we had a chance to get to the operating room. And so I went out into the waiting room where his family had quickly gathered, and I said to his relatives, "We need blood. I need you to step forward and donate blood. We're going to try to find a match so that we can save the life of your nephew." Well, his family drew back. Blood? You understand, in traditional Chinese culture, the blood is the life. It's the soul of a person. It is their essence, their being. And so to give away your blood is indeed a life-threatening event. It's death-defying to donate your blood, to give your soul away to someone else. His family was holding back. And we see this in the United States as well. Some of you are regular blood donors, but some of you are pretty terrified about the idea of donating blood. And so our blood banks are constantly looking for people that are willing to step forward and to give a piece of their life, indeed, on behalf of another person. In our world, there are many dangers. It is human nature to step up to a danger, to step up to a challenge. What challenge will you choose? Will you choose to fight illiteracy? Will you choose to defend refugees? Will you take on some healthcare crisis as your particular challenge? In our world, it's also human nature to defend. But whom will you defend? You're going to have to make some decisions. Yes, you're going to defend your family. We understand that. But who else will you defend? Whom else will you rescue? For whom will you give yourself? Now, at this event, we're especially interested in people living in great poverty. So we can look at an image of the nations of the world and we can say, wow, those people are surviving on just a few dollars a day. We want to do something substantial on behalf of them. And so there are organizations like those you are a part of who are making substantial investments on a part of great people like this. But you don't necessarily have to have a passport to engage in this kind of work. Within our own United States, there are counties in red where more than 2/3 of the population lives in poverty by United States standards. Who are these people? Often, they are undereducated. They're non-English speakers or English as a second language speakers. They're disabled individuals. They're the elderly. And the very same principles of international health care that we talk about in this conference can be applied on behalf of people such as this within our own United States. People who live within just a few miles of this center here in the city. You can be engaged in service on their behalf. But not everyone does. It's almost like searching for blood donors. How are you going to find people who are willing to sacrifice a piece of themselves on behalf of others? Healthcare professionals in particular are, in a sense, like other potential blood donors. We have our apprehensions. We have our reasons. For example, we say, gee, I don't know anything about those diseases. I don't know anything about schistosomiasis, advanced HIV care, onchocerciasis. Well, to this I would say, you are very smart people. Look where you've gotten in your education. Can you self-educate yourself? Can you learn about a disease that maybe you need to be familiar with? I certainly believe so. And one of the most effective ways of learning is to find a mentor. Find someone who is serving in the community that you want to serve and spend time with them. Find out how they approach those diseases, those particular patients. Someone who is not only a source of information to you, but who is also a role model whom you can emulate in your own attitudes and your own actions. Sometimes people will say, I want to engage the world, but I might get sued. What if I have a bad outcome? What if someone decides they want a piece of me because they don't feel good about the care they received? Now, yes, it is a potential. It has happened that international medical volunteers from North America have been sued. It's very unusual. In fact, it's very rare. In 13 years of sending volunteers and students to other nations, we've never had a case raised against us at Inmed. And you can buy international liability insurance for a couple of dollars a day that will cover your service. But far more than that, people will almost always be very appreciative of you. You know, many individuals that we serve have never seen a healthcare professional in their life. And they will be touched not simply by your service, by your professional skill, but by the fact that you are there on their behalf. An act of goodwill. Well, isn't it dangerous? Won't I get some exotic disease if I go serve in Guatemala or Thailand? What about those vaccinations? Be assured, the leading cause of death of Americans who travel internationally is not malaria, it's not schisto, it's not yellow fever, it's actually traffic accidents. So stay out of those brightly colored minivans. You'll probably be just fine. And whatever you do, don't rent a moped, right? I don't speak their language. How am I going to communicate with these people? Well, you already speak the single most useful language in the entire world, English. And if the people you're serving don't speak English, for dollars a day you can hire an interpreter who would love to accompany you and help you with that. And if you had studied some German or some French or even some Arabic or Mandarin in college, what a great opportunity to re-immerse yourself and to engage in mastering that language that was once a part of your education. I don't understand their cultures. These people are very different from me. They dress differently, they eat differently, they talk differently. You know, they hold hands when I would never hold hands. They hug each other in ways that... Well, there is nothing more insightful about our own culture than to see how other cultures behave. So welcome that opportunity to connect with someone who is very different from yourself. I think you'll discover that most differences are not ones of right and wrong. Rather, they're just differences in behavior that don't really have a moral stance behind them. And the things that we assume as right and wrong about our own culture are seen in a much different light when done so from the perspective of someone else who is different from ourselves. What about money? And this is the number one reason why I hear people say they can't do what they want to do. How am I going to get by financially? How are you going to get by? A lot of you have been to grad school, or you're in grad school right now. Did you go hungry in grad school? You know, did you ever have hunger pains because you haven't eaten in a few days? I don't think so. You're probably managing your life pretty successfully. Continue to live like a grad student. That's right. Even after you have a nice income, some security, continue to live like a grad student. And this is the biggest danger that people get into, is we get our education or we get close to the end and then we start buying things. A lot of people in healthcare buy a house, and then they buy a car, and instantly they have done what? They've doubled their debt load. And so instead of taking 5 years to be financially free, it's going to take them 10 years to get financially free. And yet you know people who have managed their finances well, who have been unleashed from the shackles of financial bondage and are able to engage in the kind of work that many of you dream about. And so use your financial resources very wisely. Cut those shackles. And while you're paying down your debt, take advantage of those opportunities to continue serving. So if you live in Kansas City, we have a network of clinics that are providing care for the poor. See if you can volunteer with those. Live out the virtues that we're talking about day by day while you're paying down your debt and simultaneously serving the poor who are around you at this moment without needing a passport. What will my parents say? So I'm coming to my father and I say, Dad, I'm going to leave for a few years, and I'm going to go to this country 8,000 miles away, and probably won't be home. Oh, they're not paying me, by the way. What do you think of this idea? And my dad, like all responsible parents, said, no, that's crazy. Why are you doing this? And your parents will say no, too. But you got to understand, they're just doing their job, right? Parenting 101, protect my child from harm. And then they will brag about you. They'll tell their friends what great things their son and their daughter is doing. What about your kids? Are your kids going to be deprived? If you decide to raise your family in a low-resource, cross-cultural setting, it's true, your kids might not start piano at age 6. They might not have ballet lessons at age 8. They might not be in a soccer team by the time they're in 6th grade. But they will have more time with you than most children. They will grow up learning probably at least one more language, if not more. They will understand other races and cross-cultural relationships in a way that very few North Americans get to experience. Your children will very likely turn out just great in such a setting. I'm not a spiritual person. I can't engage in this kind of work. Well, it is true that many of the world's most effective healthcare projects were started by spiritual, religious kind of people. Is that a requirement? No, it's not a requirement. These are people living out their faith day by day, but there are many other well-meaning, secular or other religious background people who are engaged in this kind of work as well. And personally, I find that extremely fascinating. I love working with people that are different from myself. I think it's a beautiful opportunity. You know the story of the Good Samaritan. It is a cross-cultural care scenario told by Christ where he describes a Jew who went on a journey, was attacked by thieves, was left for dead, and a foreigner came back and noticed him and had compassion on him and picked him up and paid out of his own pocket, gave his own blood on behalf of another international. It's a beautiful model that we can continue to emulate. What if I give myself in this way and people don't get any better? What if I spend years at a place like the Baptist Medical Center in northern Ghana taking care of the poorest of the poor, and after a decade, they're still dying of malaria, measles, malnutrition? So what? Let me tell you the story of Erica Horton, a medical student from KCUMB here in Kansas City that we helped to go do her month of work at Baptist Medical Center. Well, she writes, I took care of so many children who were dying of pneumonia and dehydration, often 5 or 6 every single day. She goes on, we did our very best to try and save them, giving intravenous fluids and antibiotics. And often, I would look at a child whom at first I thought would surely die. The next day, who would give me a smile. What could possibly be more rewarding? Now, is there still pneumonia and measles and malaria in Ghana? There sure is. But Erica made an impact on some babies who are alive because of her service. What could possibly be more rewarding? Well, in spite of accounts like that, there is some pushback going on. People are looking at those who are engaged in service and they're saying, we're not doing this quite right. We're creating dependency. We're not fully engaging our national hosts. Now, it's true, we can do our work better. And that's one of the reasons why you're here. You want to figure out how to do your work better. And that's wonderful. But let us not forget that helping does not always hurt. Helping often really does help people. It really does save lives. Your investment on behalf of others, the blood that you donate, is saving lives. More than that, it's bringing hope to people. What about the parents of this baby? The sorrow that they have been saved because someone stepped out and provided care on behalf of their daughter. Well, it's a big step into the unknown. I just don't know how to get started in healthcare for the poor. Like, how do I choose an organization? Do I need to learn another language? Do I need some special skill set? Where do I begin? And this is the very reason why 13 years ago we formed the Institute for International Medicine, to help provide that bridge between your well-meaning intentions and the actual service. You see, there is a core knowledge to this kind of work, just like there's a core knowledge to cardiology or neonatology. And so in order to help people like you enter that field or do better in that field, one of the things that we offer is courses. So you can take an Inmed course in international HIV care, or in cross-cultural skills, or disaster management, or healthcare leadership, or healthcare education, in ultrasound, or in newborn resuscitation, skills that you can apply. But then beyond that, we have partners in 25 developing nations who want to teach, who want to give you an opportunity to take that head knowledge and take those great intentions and actually apply it on the part of people in a setting in which you get to use your skills. It's mentoring, it's precepting, it's role modeling, helping you make that bridge in care. And then we recognize our graduates with a diploma in international medicine and public health. For those of you who are NPs or PAs or physicians or dentists or pharmacists. We also have a track in international public health designed for RNs and for undergraduate students, and for those of you in healthcare administration and ethics. This is the 11th year of the Exploring Medical Missions Conference. This is meant to be a rallying point, an opportunity for you to learn some useful facts and to connect with sending organizations like those represented to figure out those next steps for you. But we've learned over the years that this is more than just medical missions in the traditional sense. The concept of medical missions is often one of 5 to 7 days, short-term group, provide some episodic care. And actually what we're all engaged in is in far more than that. What we're trying to do is community development and more long-term service. And for those of you who are doing short-term things, I encourage you to go back to the same place, build a relationship over time, provide vacation coverage, some continuity. And because of all of these reasons, the name of this event is changing next year. So in March, we will be holding the Inmed Humanitarian Health Conference with the intention of focusing on the broad impact, the broad influences on health, which include education and economic development and community development, and that it's not something that's just short-term or episodic. And so I hope that you'll join us for the last Friday, Saturday in March. And of course, you can sign up today for that event. Many of you did last night. So I left Kuo Lee, talking to his family, came back in the emergency department. He was still there, writhing in pain. Blood pressure was still low. Tachycardia was even higher. And this old man followed me out of the waiting room. He came up to me, he said, "I'll give my blood. I'll donate my blood." Turned out he was a match. very short time later, Guo Li was receiving the life-saving transfusion that we needed to stabilize him so we could do his surgery. He gave a part of himself. He took the risk of giving away his soul, on behalf of someone else. What challenge will you step up to? Whom will you defend? Universal donors. We need more of them.